But none of these studies, they ended up with a biomarker, let's say a diagnostic biomarker, susceptibility biomarker, that would receive any sort of approval from FDA, which is a national federal regulatory agency in the US. And there are reasons behind that. So with all the efforts that people have done, it has not been very successful. Why? One of the challenges is lack of transparency and harmony in the field. What does it mean? So we brought together all those people who are doing, major labs that are doing fMRI drug curie activity, and asked them, what are the features of the fMRI drug curie activity studies that you have to report in a paper? You have to report it. Because if you are not reporting those pieces, nobody understands what you have actually done in your study. Make sense? Okay? So, and based on that, we developed a checklist that is already published in Nature Protocols. And we evaluated the studies based on these checklists. And we saw that, as you can see here, these items in the checklist, and these are the numbers of studies that they actually reported those items in their studies. So as you can see here, many of these factors have not been really well reported in the published studies. The factors that everybody agreed that these are critical to be reported if somebody wants to replicate or use the data, okay? And if you put all them together, there are just something like there was one study that reported something like 90% of those factors. There were just something like 9 studies that they reported some of them. And many studies, they have not reported them carefully. So there is a lack of transparency in the field, which is making things more complex. And when we published the checklist, we have been looking into how things are changing over time. So before 2017, this is the level of adherence that the studies had to the checklist. And we published the checklist in 2020, okay? And we have been hopeful, we are hoping that things are going to improve because of the checklist that we shaped, okay? We even brought together major editors in the field. For example, editor of JAMA Psychiatry, editor of Nature Neuroscience, editor of Neuropsychopharmacology. We had a panel together. We discussed that, how to push that forward in the field. And nothing changed. So after 2 years, we have been following things in the field, and the quality is not improving. So we do our best, but I mean, there are people who are doing their own thing. So it's just hard to make people to follow some of those instructions. We have another paper discussing about all those, what we call reporting checklists. And I highly encourage you to think about when you want to do a study, to do it in the best quality and report things that are necessary. So this is one of the challenges that we have in the field. So looking into what we already have in the field, that was one challenge. The other challenge that we have, when you want to go to FDA and ask for qualification and approval, they ask you to report 2 major things. One is COU, or context of use, and the other is biomarker specification. So you need to report these 2 things. So COU means context of use. And you need to also report how this biomarker is developed, the specification of the biomarker. And if you look to all those studies, you see that those 400 something biomarkers that we have lots of evidence for them, they are using different ways, different types of specification, different types of design. And if you go to their context of use, they are using those biomarkers in different contexts, for different substances, for different biomarkers. So it's hard to find one biomarker that has a specific context of use, a specific specification that has been replicated 5 times. So there are 400 pieces of evidence, but they are spread around in a way that there is no replication. Nobody replicated something that you can say, okay, 5 studies showed that this specific biomarker with this specification has been replicated. And that is one of the challenges in the field. So it is just widely distributed around. So if you want to push the field forward, we need to clearly define the specification and clearly define the context of use. And we need to bring our forces together for that. And then going to FDA, there is a specific pathway in FDA that you can receive the approval. And it is not that hard, but we need to bring our resources together to be able to do that. To be able to do that, we started in Medical Discovery Team for Addiction to develop a network of people who are doing craving studies with drug cues and things like that in the field of addiction with human subjects, human participants. And we called it ACRI network. And we are asking people to contribute their databases. And we already put together quite a large database within Enigma Addiction. Leadership is Hugh Garvan, fantastic guy, University of Vermont. In the field of structural imaging, they already have some as you can see here, 16,000 cases with the structural imaging with substances, different substances. Diffusion data, 7,000. Resting state, 10,000. So there are larger databases. And we are shaping one specifically on fMRI drug cue reactivity. And so far we have some 2,000 data points there on that sort of database. And we are doing some data analysis. For example, now we are putting together some 20 different studies in the field of alcohol use disorder and shaping an fMRI drug cue reactive map from a large group of different labs and showing that they all converge together in a large size of database. And Antoni Juliano is one of the leaders of this activity that we are pushing. So we are trying, and we are inviting others. So we invited Eduardo and others to contribute databases, and we are trying to push that forward. But beyond these lists of biomarkers that we can see here, there are other interesting areas that the best biomarker platform is not covering. And in the second half of my talk, I'm going to talk about those biomarkers that are definitely interesting potentials. I'm going to discuss about them.